Hello, everyone, and welcome to the Arthritis Society's special edition of Arthritis Talks, COVID-19 and You. I'm Dr. Sean Bevan, Chief Science Officer at the Arthritis Society. Before we get underway, a few logistical pieces of information. The webinar is best viewed on a laptop or desktop computer. Please remember to turn your sound up in order to hear us. If you do not have access to a computer right now, you can listen to the webinar on a phone. Dial the phone number that is listed in the confirmation email you received after you registered. Once you call the phone number, remember that you will also have to enter the 9-digit webinar ID number, followed by the pound sign to log in. If you have a question, click on the Q&A button at the bottom of your screen on your computer and type your questions. Or you can email it to arthritistalks@arthritis.ca. We will try to get to as many questions as possible during the hour we have together today. If you would like to chat with the online moderator of this webinar, please click on the chat button at the bottom of the screen. Let's get started. We, the Arthritis Society, is Canada's national charity dedicated to creating a world where people are free from the devastating effects of arthritis. We do this by funding research, by advocating to governments on your behalf, and by providing timely, evidence-based information to help you live a good life. We have received countless of emails and calls about COVID-19 in the last several days from all across the country. While we understand that this is an uncertain time for everyone globally, we recognize that people living with arthritis have a heightened sense of concern and are feeling especially vulnerable at this time. I want you to know that we are here for you and will continue to be here to do everything we can to support you as we navigate this chapter together. This Arthritis Talks webinar is just one of those forms of support we provide. I am pleased to welcome Dr. Vandana Ahluwalia, rheumatologist at the William Osler Health Centre in Brampton, Ontario, and past president of the Canadian Rheumatology Association, to speak with us today. Dr. Ahluwalia is one of Canada's leading rheumatologists, having practiced for 25 years, and has been deeply involved in efforts to help people with arthritis stay healthy during this difficult period. Dr. Ahluwalia is going to take us through a presentation, and then I will ask her the questions you are communicating to us. Joining us now online is Dr. Vandana Ahluwalia. Welcome, Dr. Ahluwalia.
Thank you, Sean. It's a pleasure to be here today. Unfortunately, under perhaps not the best conditions as to what's happening around the world with COVID-19. As Sean mentioned, I am a rheumatologist, and I am not an infectious disease specialist, but I have compiled a considerable amount of information based on the recent research that has been done, and also some verbal information from infectious disease specialists who are my colleagues. So I have a presentation for you that hopefully will give you some background on this condition and will answer some of your questions. The information, as you know, is changing on almost an hourly to daily basis. So the information that I'm presenting you today is as up to date as of yesterday. So let's start with an overview of the presentation. I'm going to start with telling you about what is COVID-19? What do we understand about this virus? What are the symptoms and how can we stop the spread? Then I will proceed on to answer some commonly asked questions by people with rheumatic diseases and arthritis, questions that my patients have asked, and also questions that you have sent in to the Arthritis Society. And then finally end with what should you do with yourselves over the next few weeks. So the first question is what really is a coronavirus? We know that there are 4 different types of coronaviruses that normally affect humans. They almost present as the common cold symptoms, and there are other common cold viruses as well called rhinoviruses and adenoviruses. However, there are 3 novel coronaviruses that can cause serious illness. The first one was discovered in 2003. It was called SARS-CoV-1. That was a severe acute respiratory syndrome, and it was a SARS outbreak. It was not considered a pandemic at that time. The next serious coronavirus was the MERS virus, or the MER virus. It's called the Middle Eastern Respiratory Syndrome, where it was first discovered, and it was reported in 2012. And now we have a new virus called SARS-CoV-2. So the virus is actually called SARS-CoV-2, but the disease is called COVID-19. Now, how do we get that name called COVID-19? Well, CO represents corona, VI represents virus, and D represents disease. 19 is a year in which it was first discovered. On February 11th, the World Health Organization gave the disease its official name, which is now called COVID-19, which I'm sure you are very familiar with. Question is where does corona come from, the coronavirus? Corona actually comes from Latin meaning crown or halo, which actually refers to the characteristic appearance of the club-shaped protein spikes that are on the surface of this virus that we can see by electron microscopy. So this is a coronavirus or COVID-19 pandemic. What does that really mean? Well, we know that certain diseases are endemic. In other words, they occur on a regular basis in certain parts of the world. So for example, dengue fever occurs in certain parts of the world, and we regularly see cases of it. If the number of cases of dengue fever, for example, increase, that is called an outbreak. In other words, higher than the normal rate of infection. If that outbreak is serious, then it's called an epidemic. Once that epidemic crosses the border, it is called a pandemic. So a pandemic is a worldwide spread of a new disease according to the World Health Organization. Now, what's interesting is it doesn't really tell us in that definition whether there's a lot of cases, how serious they are, or whether there's a lot of deaths. It really, that's not part of the definition. It's really only the worldwide spread crossing borders. So how do we get to the situation we're in right now? Let me give you a little bit of history and background. The pandemic coronavirus, or COVID-19, was first reported on December 31st, 2019. The World Health Organization China Country Office was informed of cases of pneumonia of unknown etiology in Wuhan City. Wuhan City has actually become quite famous now, and it's in the province of China. The outbreak began in a seafood and poultry market in Wuhan, which is a city of 11 million people. Like the SARS virus and the MERS coronavirus, the newly detected coronavirus had a zoonotic or animal source. However, subsequent human-to-human transmission was confirmed. So if you go to the top right-hand corner, researchers think that the new coronavirus originated in bats, and it might have jumped to an intermediary species like pangolins or scaly anteaters, pigs or civet cats. Those types of animals are considered exotic animals and are consumed in some of the Asian countries. And what happens is these animals are slaughtered in this market, and that's how, if those animals are infected with the virus gets out and can spread to humans. This spread to humans is then continuing to spread to other humans via respiratory droplets. In other words, if you are within 6 feet of a person who is infected and contagious, you could potentially get the virus. So what happened after that? On January 30th, the WHO declared that the 2019 novel coronavirus outbreak a public health emergency. On February 11th, the WHO announced a name for the disease, COVID-19. On March 11th, the WHO declared COVID-19 a pandemic. So these are results from Johns Hopkins University, and they are updated as of March 23rd, which is just a few days ago. This graph shows you the 367,000 cases of coronavirus globally. There have been about 100,000 recoveries and 16,000 deaths. The recent reports from China reveal that 80% of people have a very mild illness. About 15% are hospitalized. 5% require intensive care unit intubation and ventilation, and about 1 to 3% will die from this virus. So this is a snapshot in time, and this was actually taken yesterday, March 25th, 2020 at 9:52 p.m. I took a screenshot of the Johns Hopkins Coronavirus Resource Center. This is been set up by Professor Lauren Gardner, who is a civil and systems engineer, and her group. The map was first shared publicly on January 22nd, and it reports all the cases worldwide of COVID-19. This map is near real time, and throughout the day, there is an update of the numbers, either manually or through automated updating. The information is from data sources such as the World Health Organization, US Centers for Disease Control, and other public health agencies. So what you can see on the left-hand side is over 470,000 cases have been confirmed for COVID-19. China is still leading in terms of the number of cases, but China is not growing rapidly in terms of cases. A few days ago, China had about just over 81,000, and now it has 81,667. Italy is very close behind, but the US is certainly catching up, and the US now is the third leading country in which this coronavirus cases have been confirmed. You can see on the right-hand side that there are 21,000 deaths and about 114,000 people who have recovered. And you can see worldwide in the middle where there is clusters of cases. So what about Canada? I took a snapshot a few days ago, March 21st at 4:13 p.m. There were just over 1,000 cases in Canada. And on March 25th, last night, there were over 3,000 cases of Canada. The virus tends to double every 4 to 6 days. It's very important for you to know as a community member how the virus spreads, because the best way to prevent the illness is to avoid it and avoid being exposed to the virus. There's currently no vaccine to prevent the coronavirus disease at this time. And we know that the virus is thought to spread mainly from person to person. How is it spread? Between people who are in close contact with one another, within 6 feet of each other. This is spread through respiratory droplets produced when an infected person coughs or sneezes. These droplets then land on the mouths or noses of people, even into the eyes of people who are nearby, and it can possibly be inhaled into the lungs. So some questions have arisen that how do I know if somebody I'm interacting with is potentially infected but doesn't have symptoms yet? Well, you can see from this graph that in fact, you are the most contagious when you actually develop your symptoms. So it is important to know that people who do not have any symptoms tend to be very less contagious. But once you develop symptoms, that is when you can spread the virus to other people. Good to know that some of the greetings that we have used in other cultures are now a good way to interact with people during this pandemic. A wave or a nod or a bow or even a namaste is a good way to greet someone. Washing your hands is particularly important to get rid of the virus and prevent its transmission. You need to wash your hands with warm water for at least 20 seconds, getting into all the crevices of the fingers. And that's the single most important way that you can protect yourself and others. The virus is not a living organism. It's actually a protein. The protein is enveloped by a lipid layer or a fatty layer. When you wash your hands with soap and water, that actually breaks down that layer and allows the virus to disintegrate and decay. It doesn't stay on surfaces for more than a few hours. If you cannot wash your hands, then the next best thing is to use hand sanitizer. In addition, you can sanitize surfaces that are commonly touched and used with Lysol wipes. If we know that some of these supplies are in high demand and may not be readily available at this time, so you can make your own. A homemade remedy, for example, is putting 4 tablespoons of bleach into a liter of water, and there you go. You have an antiviral solution you can use on surfaces. Please don't drink it. So there have been many questions around wearing a face mask if you are sick. The recommendations by the Centers for Disease Control are that if you are sick, then you should wear a face mask. If there is a person who is looking after you while you are sick, they should also wear a face mask. However, if you are not sick, then you do not need to wear a face mask at all. Face masks in general are in short supply, and they should be saved for healthcare providers or caregivers who are interacting with people who are ill. Some may ask, well, what kind of face mask should I use if I may be infected or are infected or looking after somebody who's infected? A simple surgical face mask, as shown on the right-hand side in blue, is sufficient to prevent the transmission of the virus. Because remember, the virus is a droplet and the face mask will catch those droplets. You may have heard of something called an N95 mask or a respirator mask. These masks are used by healthcare providers during high-risk procedures on people who may be infected, such as intubations or bronchoscopies. These masks come in different sizes and they have to be fit properly for your facial structure. It is not recommended that you buy these N95 face masks for personal use. They are also in short supply and they are necessary for healthcare providers who are dealing with people who are potentially infected. So you may have heard of some terms called social distancing or physical distancing. I'm going to show you a pictorial of how social distancing and physical distancing can help. An infected person can infect up to 2 to 3 people every time. By instituting social and physical distancing, you can prevent the spread of disease. And clearly you can see that if you stay at home or work from home, or do not go to that party or barbecue, and you don't fly, the number of patients who get the disease is going to be reduced dramatically. Let's look at it another way. You can see from this pictorial the power of social distancing. This virus is very contagious, and people who are sick with the virus shed a high volume of particles through respiratory droplets. Standing 6 feet apart from the person next to you is the first step. Stay at home, avoid contact with groups of people, limit your exposure in public places, and that will keep you and your family safe. Another term you might have come across over the next few weeks in the media and in social media is something called flattening the curve. And it has been mentioned by our public officer of health as well. What we need to do is we need to flatten the curve. Does that really work? What is the curve, first of all? Well, the curve researchers are talking about refers to the projected number of people who will contract COVID-19 over a period of time. This is a mathematical modeling, and it's not really representative of real patients, but this is what or how the virus behaves. So you can see in that first hump, which is in orange, that this is the number of people that potentially would be infected if we didn't use any precautions. What happens then is if you have social distancing and physical distancing, we flatten the curve. We make the curve shorter, and that way our healthcare capacity is able to deal with those people who are infected and take care of them. So where did this concept come from in terms of the social and physical distancing to flatten the curve? Well, we know that there was a serious pandemic called the Spanish flu around the time of World War I in 1918. And this caused a global pandemic. But what was interesting is that it affected people in the US, and there were 2 US cities that actually had very different outcomes. In Philadelphia, city officials were told by the infectious disease experts that the flu was spreading across the community. The city instead moved forward with a massive parade and ignored that advice. Hundreds of thousands of people gathered together. Within 48 to 72 hours, thousands of people around the Philadelphia region started to die. Ultimately, about 16,000 people from the city died over the next 6 months. What is interesting is that St. Louis had a completely different outcome. In St. Louis, the city officials actually quickly implemented social isolation strategies. They closed schools, they told people not to go to work and work from home, they limited travel, they encouraged personal hygiene and social distancing, staying 6 feet apart. As a result, the city only had 2,000 deaths, 1/8 of the casualties that Philadelphia had. So as you can see, social distancing and physical distancing does make a difference. So now it is up to you to do what you can to help prevent spread of this virus. You need to wash your hands for 20 seconds with soap and water and warm water. Avoid touching your face or your nose to prevent the virus from entering into your body. Do not greet people by shaking hands, hugging, or kissing now. Use namaste to say hello. You can limit your contact with other groups and close contacts by staying 6 feet apart, at least 2 meters. Cancel all non-essential and international travel, and clean high-touch objects and surfaces often with appropriate cleansing materials that are antiviral, and you can make them at home. Some of the symptoms to look for are fever, a cough, which generally tends to be dry, sometimes a sore throat, and sometimes diarrhea, and shortness of breath in more severe cases. If you are sick, stay home and avoid other people. So the Government of Canada launched a website on March 22nd called the COVID-19 Symptom Self-Assessment Tool. You can go online now and you can evaluate your risk based on the symptoms that you have, and this will help you determine if you need to seek medical advice. So when should you seek treatment if you develop symptoms? Well, if you develop symptoms that suggest COVID-19, such as fever, cough, or difficulty breathing, the most important thing is isolate yourself. Wear a mask and separate yourself from other people. Then what you do need to do is take a self-assessment tool. And you can get those on the Ministry of Health websites in your local provinces or through the Government of Canada, as I just showed you. You can also call 311. 311 is a non-emergency phone number in many municipalities across Canada where you can get information on public health centers. You may be directed to a hospital or a regional assessment center. If you feel that your symptoms are worsening, then you should visit your local emergency department to be evaluated. So some of these other terms have been also been in the media, and it's important to know what these terms really mean. For example, there are 3 different terms that are being used in the presence of this virus. One is called self-monitoring. The other is called self-isolation, which essentially is quarantine. And the third one is called isolation. This Government of Canada poster is found on the Government of Canada website, so you can have a look at that because, as you can see, the text here is very small. So I'm going to just walk you through the 3 scenarios. So in self-monitoring, basically you have no symptoms. You may have had a history of possible exposure to the coronavirus. So in this situation, you should monitor yourself for symptoms such as fever and avoid crowded spaces, but you can still go outside. Self-isolation, on the other hand, is you do not have any symptoms, but you may have been exposed or you came from another country where there was an outbreak. In this situation, you should stay at home and avoid contact with other people. In other words, don't go outside for another 14 days. And finally, in isolation, you have symptoms, you're waiting for your nasopharyngeal swab results to come back. It can take a few days, or you've been diagnosed with COVID-19. In that situation, you should stay at home, you should not go out, and you should also distance yourself from the people in your home. So let's talk a little bit more about the virus before we get on to our questions. So the question is, how lethal is this virus? There were some reports to say, well, you know, influenza has a high death rate, and perhaps this is just a bad influenza. Well, you can see here that influenza has a death rate of about 0.1%. The COVID-19 estimated death rate, particularly in South Korea, where they had done a lot of testing, was about 4.3%. New data on mortality has shown up to 3% from the recent data from China. On the right-hand side, you can see a graph to show the flu virus. It affects mainly older people and has a fairly low death rate compared to COVID-19, which can affect multiple age groups, particularly older, and a much higher death rate. So the question is, are there effective treatments? Well, the best treatment is avoidance and prevention. However, some other treatments are being evaluated currently for those people who are particularly ill. Remdesivir is an antiviral agent that's being evaluated. Lopinavir and ritonavir are anti-HIV or AIDS drugs that have been evaluated but not showing a lot of promise yet. What's very interesting is immunosuppressive agents such as hydroxychloroquine or chloroquine or JAK inhibitors or interleukin-6 inhibitors are also being evaluated to treat this condition. And some of these medications are being used in combination. We know that the vaccine may be at least a year away, if not longer. We also know at this point in time that there is no evidence yet that the warmer weather will result in less transmission or cases, as is the case with the flu. So let's move on to some questions that have been either sent in to the Arthritis Society or have been asked by my patients, and I think they will be very helpful for you. What should I expect if I need to see my doctor about my autoimmune or arthritic condition? Here are a few tips to keep in mind. What you will need to do is you will need to call your doctor's office before going in, as some offices may be closed or not doing face-to-face visits or in-person visits. It's important to know whether your doctor's office is open for that or not. Otherwise, care is currently being delivered by phone visits or other virtual means in the upcoming weeks to days. Days to weeks. In fact, over the last couple of weeks in my practice, and the other rheumatologists in my practice have been seeing patients by phone visits, and it's been a very pleasant experience, I must say. Patients are appreciating it, and we're able to take care of all of their needs. Sometimes when we need to see the joints or patients are flaring or perhaps there's a rash or something like that, then we do video visits. And those video visits are through various different platforms that have been available but have not been widely used until recently. And they're actually working quite well. Some of them are on their own, and some of them are embedded in the electronic medical records. If you do need to see your physician, and your physician is seeing patients in person, you may be asked to wait in the waiting room, and you may be separated from another person on opposite sides of the waiting room, depending on how large it is. And also, you may be asked to wait in your car, and the secretary will call you when the doctor is ready to see you. So we're hoping that all of our patients can still have their care delivered in these different ways, including taking care of prescriptions, also monitoring blood work requisition, ensuring that your disease and your condition continues to be controlled. So this is a burning question that came up as well, is because there was quite a lot of interest based on some tweets that were sent out on ibuprofen. And the question is should you stop your anti-inflammatories if you're taking them for your arthritic condition and you need them? Well, what happened was, and I'll give you a little bit of background of what happened here. Chinese researchers made a theoretical consideration. They found that ibuprofen and some antihypertensive drugs called ACE inhibitors increase the levels of ACE2 in the blood. The COVID virus binds to its target cells in order to be taken up by those cells and infecting those cells through this enzyme receptor called ACE2. So in other words, if the ibuprofen or ACE inhibitors increase the levels of ACE2, then potentially the virus can bind better to the cells and the organs and cause more damage. In addition, we know that 2 French studies have shown that anti-inflammatories perhaps should not be prescribed in patients who have lung infections or pneumonia, because worse outcomes were noted in patients who are on ibuprofen. In theory, there may be a suggestion that the ibuprofen acts like an anti-inflammatory drug and prevents your immune system from responding to the infection and getting rid of it. That is also in theory and not proven. These are both theoretical consideration. What happened is the French health minister tweeted that there was the death of a young patient who was on ibuprofen who died from COVID-19. And that's what sort of brought up this issue. However, at the current time, the World Health Organization, who has looked into this, the Food and Drug Administration in the US, and the National Health Society in the UK, as well as the European Medicines Agency, says there is no scientific evidence that non-steroidal anti-inflammatory drugs such as ibuprofen could worsen a coronavirus disease. So if you are taking your anti-inflammatories for your arthritic condition, you should continue to do so. Now, the question is if you have COVID-19, in general, people will have a fever, and the fever is uncomfortable. For that fever, the first recommendation is that patients should try Tylenol or acetaminophen to improve the fever. If that does not work, then other anti-inflammatories can be used. So there's been a lot of talk about hydroxychloroquine, Plaquenil, which is the brand name, and chloroquine. So this is a very interesting time. Hydroxychloroquine and chloroquine initially was shown to inhibit SARS-CoV-2 viral replication in vitro in the lab. There have also been some anecdotal reports from China. There were about 100 patients who were given the medication called chloroquine in order to treat their COVID-19, and it was found to be successful. But the report was not a study. It was a news release of patients who were treated, so a series of cases. We don't know much about that, and we would have to understand that better to understand how this works. There was also a small study in France using hydroxychloroquine combined with an antibiotic called Zithromax. And I'm just going to show you a little bit of data in the next slide. And that was found to reduce viral shedding. At this point in time, I want to make it clear that there are no recommendations that hydroxychloroquine or chloroquine should be used in the prevention or treatment of this condition. It is very interesting, but we need more data. So the question is, how did this really come about? We know that hydroxychloroquine and chloroquine are anti-malarials. They prevent the malarial parasite from entering your cells. So the first theory is that there is a possibility that chloroquine may alter the ability of the virus to bind on the outside of the host cell. And that's how it may prevent the cell from entering. In addition, what happens is once the virus enters a cell, it's engulfed by this cell and gets into its environment, but that environment has to be an acidic environment. Chloroquine causes the environment to be alkaline, and altering that environment prevents the cell from taking up the virus. So there is some interesting theories as to how these medications could work. And we're at the point in time where if we have some medications that seem to make sense in terms of treating this condition, then it would be much easier to repurpose those medications as opposed to finding new medications, because we are in an emergency situation. Hydroxychloroquine and chloroquine are relatively inexpensive to produce, and they're easier to manufacture. So as I mentioned, the Chinese study has not been published, so we don't have data on that. But the French study, which was a very small case series, is interesting. It was published in a journal on March 17th. And what happened was there were 42 patients who were screened, 26 patients met the entry criteria, and 20 patients were treated in an open label fashion. In other words, the doctors and the patients knew they were getting the drug. After 6 days of treatment with a combination of hydroxychloroquine, 200 milligrams 3 times a day, and Zithromax, a Z-Pack of 5 days, you can see in this graph, the red represents the patients who received the treatment, and the black represents the patients who were not given the treatment. The patients were checked for positive nasopharyngeal swabs for viral load. And you can see from the red line that at day 6, the patients who were treated had significantly reduced SARS-CoV viral load. So while this is very interesting, we do not know about the course of these patients. What was the morbidity? What was the mortality? How do these patients survive? How are they doing now? We don't really know. So more information is required for us to make further recommendations. It's very important that we have an adequate supply of medications for your rheumatic conditions, such as hydroxychloroquine or chloroquine, or perhaps even those biologics that may be utilized to treat COVID-19. Health Canada takes this very seriously, and they have said that the medications required for patients with specific diseases should be prioritized for them and not to be dispensed for prevention purposes or treatment purposes, for that matter, until further evidence is available. These should be done in properly conducted clinical trials and perhaps in hospitals. On March 23rd, a few days ago, the Ontario Medical Association, the Ontario Pharmacists Association, and the Nurses Association issued a joint statement. They said professionals should act in an ethical way. We need to ensure the safety of the medications prescribed. Do not self-administer these medications. They may have potential side effects, and you may have other health problems in which this medication is not for you. We need to ensure fairness in the use of resources and make sure that those people for which these medications are appropriately approved should get the medications to ensure their condition remains stable. And we should give medications based on the best available scientific knowledge. And that knowledge is evolving, as I mentioned, over hours to days, and maybe we will have more information as time goes on. I do know that the WHO is conducting a trial called the Solidarity Trial, and they will be looking at 4 different treatment arms. One of them may be a hydroxychloroquine treatment arm. The next question is am I at increased risk due to my autoimmune condition or immunosuppression? At this point in time, we don't really know. We don't have all the answers. But there are some considerations as to what is going on. So we know that the morbidity may be due to what we call immune activation or inflammation. In other words, when you get the virus, you have a high viral load, but your immune system tries to combat that virus, and sometimes it goes into overdrive. And it creates what we call a cytokine storm. That cytokine storm has a particular cytokine called interleukin-6 that seems to be a key player. Now, sometimes when people who are immunosuppressed get an infection, such as a viral infection, they can get a super infection called a bacterial infection. And in that case, both those infections can lead to worse outcomes. Now, on the flip side, we could think, well, maybe your immunosuppressive medications are protective. Your body is not going to mount that cytokine storm, and maybe you will not get the serious symptoms. There are also some immunosuppressive therapies, such as interleukin-6 inhibitors, that are being evaluated in treating the serious viral complications to improve outcomes. So at this point in time, the question of should I stop my immunosuppressive therapy at this time to protect me? Well, the answer is if you are well and well controlled and your disease is well controlled, the answer is no. You should continue to take your medications as prescribed. If, on the other hand, you have COVID-19, we don't really know the answer to this because this is a novel coronavirus. However, we do know from past experience, and usually I recommend to my patients that if they have a fever or they have a serious viral infection, they're feeling particularly ill, or they have a bacterial infection for which they are on antibiotics, I recommend a usual interruption of disease-modifying agents such as methotrexate or leflunomide and JAK inhibitors or biologics during the time when you are ill. They can be reinstituted when you are better, because having a flare of your disease will actually be a worse outcome as well. So what if you're receiving a biologic at an infusion center, something that's given intravenously? The recommendations at this time are continue to receive medications as prescribed by your doctor. Some infused medications do have an injectable version which you could be switched to if requested and appropriate, but you need to discuss that further with your doctor. The infusion centers have policies in place to protect you, screening you on the phone or on arrival, and keeping you a safe distance from other patients as well. And finally, the last study that I want to show you is the characteristics and outcomes of 21 critically ill patients with COVID-19 in the Washington state. This hospital in Washington state had 21 serious cases and the first death in the US. What they found was that they looked at what are the risk factors for patients to have serious disease and be put into the intensive care unit. They found that age was a risk factor, mean age was 70. They also found that chronic kidney disease, congestive heart failure, COPD or emphysema, and diabetes as the most common comorbidities. On the left-hand side, you can see the table that looks at the types of patients that ended up in the intensive care unit. One of them had rheumatic disease, and 3 of them were on immunosuppression. So you can see from this small case series that maybe this is helpful to us, for us to understand whether you are at risk or not, and the risk in this particular series of patients was low. Finally, your local rheumatology community, Canadian Rheumatology Association and the Ontario Rheumatology Association and various other rheumatology associations in different provinces, as well as patient organizations, is keeping you abreast of the information becoming available to ensure that your rheumatologist has the best up-to-date information to evaluate your condition. The Global Rheumatology Alliance is also launching a registry for reporting of cases with rheumatic diseases that contract the virus. We need to study the risks in these patients. Is your medication protective? Is your medication make you at higher risk? It's important to find out what the characteristics of patients who do better or who do worse are, and this is going to be very important for you and us. So a few suggestions from me as to what to do when you're going to be at home or the next few weeks. Important thing is work from home if you can, take your medications as prescribed by your doctor, exercise, and eat healthy. Some gyms have streaming services for classes on demand, and you can access through the internet, and also some classes on stress relief and meditation. Go for a walk outside. Just stay 6 feet away from somebody that you don't know. This is time to dust off that new book, watch a movie, take up a hobby, maybe learn a language. Enjoy this time with your family, playing board games or cooking together. That's what I have been doing. I know you want to go out to restaurants, you want to see a movie in a theater, meet with family and friends, but hold back for a few weeks until it is safe to do so. In the meantime, talk, FaceTime, or text with family and friends. Limit your exposure to others. Sometimes you can ask a family member or a friend to go get all the groceries for a few different families as well as medications. They can leave them at the front door. They should not come in. You should wipe off anything that comes into your house with a Lysol wipe or a homemade remedy. You can also get those things delivered. Listen to the advice of your public health agency and check with the Arthritis Society website for up-to-date and credible information. This is a difficult time for many people in terms of worsening anxiety and depression. Patient organization and the World Health Organization realizes this, and they have tools to help you cope with the stress in terms of you and your children and your families get through this situation. Here are some of the reputable websites for information on COVID-19. Public Health of Canada, the Government of Canada has the assessment tool. U.S. Centers for Disease Control and World Health Organization has up-to-date information on a daily basis. The Arthritis Society has some great tips on exercises and about considering anxiety and depression and helping mental health. Now is a great time to explore them. The Arthritis Consumer Experts is a patient organization, has regular newsletters and information that you can sign up for and receive by email. I hope that I've been able to give you the most up-to-date and scientifically valid information on COVID-19 disease. The evidence is quickly evolving and the advice may change in the days to weeks to come, so stay tuned. This is not about the individual anymore, but rather about the community and the population as a whole and what you need to do to keep your community and your family safe. The best medicine is prevention. My best recommendation is to stay at home, stay healthy, and stay safe. I cannot stress that enough. Thank you for your attention. I'm going to pass it on to Sean to give you an opportunity to ask some questions.
Great. Thank you very much, Dr. Ahluwalia. I am now going to open it up to questions. We have had many questions come in. Thank you all for that. Like I said, we'll get to some of them, and if not, we'll get to as many as we can later by email or on the internet. So the first question, Dr. Ahluwalia, you did touch on this in your presentation, but I just wanted to give you a chance because we've had a lot of questions about different specific arthritis medications, different disease-modifying anti-rheumatic drugs, biologics, etc. So I'll just read one question, but it really applies to all drugs that people with arthritis might be on. My worry is that I understand methotrexate suppresses the immune system quite a bit. Wondering if you would recommend stopping treatment during this time.
So maybe I can just flip to, if I can flip to my slide, I will try. Hold on 1 second. Okay, is that it? So here we are. So if your immunosuppressive therapy, such as methotrexate, is controlling your condition, then it's very important you take your medication as prescribed. Especially if you are well and your condition is controlled, there is no need to stop your medication at this time. If you get COVID-19, that's a different story. And during that time, while you are ill, then it would be important to hold the methotrexate until you are better.
Thank you. And as a follow-up to that, at what point does one consider stopping your current medications if someone does contract the COVID-19?
So I think that if you develop a fever, that is a good time to interrupt your immunosuppressive agent.
And when it comes to the self-isolation and isolation procedures that you mentioned, is there anything specific about people with arthritis that they should consider in terms of doing it differently?
I think that the isolation procedures are in general for everybody. I don't think patients with arthritis are going to be any different with respect to those isolation procedures. But what's really important is the self-isolation and isolation, it's not voluntary. It should be mandatory. And that's in order to protect the community and the population as a whole.
Thank you. We've had some questions from frontline workers. This is one of them. Hello, I'm a nurse who is also on biologics. Do we have any information on how the risk is and whether or not it is safe for me to go to work?
So that's a very good question, and that has come up in my practice before as well. So I think at this point in time, the question is what kind of rheumatic condition do you have, and what type of therapies are you taking, and whether your disease is controlled or not. So then the next piece is that if you can potentially work from home, which I suspect most healthcare workers probably cannot, but if you could work from home, then that would be the next best thing. If you cannot work from home and you need to go into work, then personal protective equipment should be available to you, it would probably be recommended to avoid infected patients if you could not have personal protective equipment. Then a discussion with your employer would be is something that you can do if you are still concerned, and see if there's some flexibility in terms of where you have to work and whether you are going to be interacting with patients who are infected or not. And then finally, you can speak with your doctor if you are still concerned, and then that discussion will help provide you some more information.
Are any of the recommendations that you are providing today different for children with arthritis?
So what's very interesting is at this point in time, children are relatively spared in terms of getting this infection. It's not common in children. The Hospital for Sick Children has tested hundreds of patients every day. Not a single positive nasopharyngeal swab has shown COVID-19. They have no kids. In China, about 1,000 children were infected with the virus, mostly mild symptoms, and very rarely are they in the intensive care unit, and I think there was one death. So I think children actually do quite well at this time. It is really the elderly who are at higher risk.
Okay. This is a question primarily about osteoarthritis. I have not gone out since the COVID-19 breakout. What kind of exercises beyond that can I do for my OA?
So that's an excellent question. We tend to be homebound. So it is, and we don't know how long that's going to be. Walking around your house is perfectly fine to do. The other thing is you can go outside as long as you stay 6 feet from anybody else that you don't know. Go for a walk. And the weather is getting nice. I think it's a great idea. And then the Arthritis Society also has on their website various exercises that you can do for your osteoarthritis, and that's a very good resource.
Okay, next question. Does COVID-19 increase inflammation and make rheumatoid arthritis worse?
So, so there is some theory that perhaps your immune response is trying to take care of the virus. At this point in time, we don't have any data as to particular rheumatic conditions and how they fare if you're infected with the COVID-19. So over the next few weeks, I am sure that we're going to be getting more information to help us, figure out what's going on with the actual rheumatic disease condition in the face of this COVID-19. But at this point in time, we don't have a lot of information to go on. So the best advice is to continue to take your medications as prescribed by your physician, and don't stop them if you are doing well.
Okay, is naproxen among the anti-inflammatories that are safe to take?
So ibuprofen is considered is basically Advil, or it's available over the counter. It's also available by prescription. And naproxen is also another anti-inflammatory. It comes in the form of Aleve, which is available which is naproxen sodium, which is available over the counter, but in smaller doses. And then there's prescription strength naproxen. So naproxen is an anti-inflammatory, and at this point in time, there is no evidence that anybody who needs to take naproxen for their arthritic condition should stop it.
Okay. This is a question from someone who says, I have rheumatoid arthritis and I'm pregnant. Does this put me and my baby at greater risk?
Oh, so that's an interesting question. There have been some preliminary reports from China where not just being at risk, or perhaps they actually had infection, the COVID-19 infection in pregnant women. And so far they have recovered. The reports suggest that they have recovered and they have delivered their babies and they're doing well.
Okay. So we've touched on this a little bit, but is it my own immune system or my immunosuppressant medications that make me more vulnerable to contracting COVID-19 and having a harder time recovering from it?
So what we know at this point in time is that your immunosuppressive therapy should be continued because it's required for your disease as well as control of your disease. There are some theories around whether your immune system may react to the virus in a way that causes something called a cytokine storm, and that produces increased levels of interleukin-6. And that may be detrimental for patients who get the infection. That's basically the information that we know at this point in time.
A few questions about regularly scheduled visits. So I have blood work and ultrasound coming up. Should I postpone them for a later date?
So the labs, our labs actually in Ontario do allow for online bookings. So you can book an appointment at your lab to go in and have your blood work. And if that blood work is necessary for monitoring, then that's something that should be discussed with your doctor as to how often it should be done, considering what's going on now. If it looks like your condition has been very stable and the monitoring could be extended a little bit, your doctor may advise you as to when you should do your monitoring blood work. The labs have online booking, so they can space you out in terms of making sure that you don't interact with anybody else when you come into the lab. However, if monitoring blood work is required, then I think you should have it done. If you have a condition for which an ultrasound is needed and it's urgent, then that should also be done. And hospitals are putting into place the physical distancing and are doing the tests that are required.
Okay. A practical question for people who are living with others. Can my husband and I sleep in the same bed if I am immunocompromised during this COVID-19 time?
So if you and your husband are both well, then there's no reason to be physically distanced. However, if one of you is not well and has a fever, then of course the physical distancing and wearing a mask by the person who is unwell is the best advice.
And I think our last question I will take today for time, a practical question. Should people with rheumatoid arthritis be using the modified special hours for grocery shopping, regardless of how bad our arthritis is?
Oh, I didn't know about modified special hours, which is interesting. So if you can allow perhaps somebody else to go and get groceries for you, that would be great. The other thing is that if you don't want to leave the house, then you can have the groceries delivered. Make sure you wipe them down with some either Lysol or some homemade remedy to make sure everything is clear and sanitize when you bring it into your house. And if there are special hours, then absolutely, where people are physically distanced. In other words, they're probably letting in only a certain number of people into a store at a certain time. So in that situation, the physical distancing is the most important thing that is going to be the best prevention.
So thank you very much, Dr. Ahluwalia, for providing this really important information to help all Canadians living with arthritis as we manage through this challenging time. If you did not hear your question asked, please visit the Arthritis Society's website, COVID-19 webpage, arthritis.ca/COVID-19. And like I said before, we will work to put as much additional information up on that page in the days to come. We've had many questions about the recording of this webinar, and yes, it will be available very, very soon. The video and the presentation slides will also be emailed to all of the registered participants. We would like to take just a few moments to get your feedback on today's presentation. So for those of you on a laptop or a desktop, you will see 2 poll questions come up on your screen with yes and no answers. Okay, the first question, did you find the information in today's webinar helpful to you? And number 2, is this format something that you would register for again? Please know that if you're unable to access the poll questions, we will be sending an evaluation form when we send out the videos, so you'll have an opportunity to offer feedback at that time. Initiatives such as this come at a significant cost for the Arthritis Society, so if you have found today's information helpful, we would welcome your support to enable us to continue our efforts. If you have the capacity to do so, please visit arthritis.ca to make a donation. Also, please remember that there is excellent information available at any time on our website, tools, tips, learning modules, and a variety of content designed to assist you from the comfort of your home. Thank you again to our expert, Dr. Vandana Ahluwalia, and to all of you for joining us today. COVID-19 is a rapidly changing situation, but what is not changing is our commitment to Canadians living with arthritis. This concludes the special edition of Arthritis Talks, COVID-19 and You. On behalf of the Arthritis Society, thank you for joining us today, and please do take care.